are the things we require today for this project. So here we see the various things we need: NG tube, of course, and the endotracheal tube, a scissors, and we got the mannequin. So here we are actually splitting. I have actually detached the cuff, and now I'm splitting the tube through the center. You need a nice sharp scissors for this. You can use blade, but be careful. Don't injure yourself while splitting that. I have used blade as well for doing that previously. Split it till the very end, and you can also rip off the cuff, but if you want to keep the cuff, it's not a problem at all. But it's already damaged, so all you need to do is rip it off, and it comes off from the, totally comes off the whole thing. So you can rip it off completely or just snip it off. So that in the end, you actually have a nice, clean split tube. You'll see that it just comes off nicely, the whole thing comes off. There you go. It's nice and clean split tube now. So here you can actually see there's a split tube. I have that is detached the cuff, pilot cuff, the cuff itself, which has been taken out. There's some jelly and various things which we actually need. And now I'm going to demonstrate how the whole procedure is actually done here. So we're going to take the endotracheal tube, sorry, the NG tube, and insert it through the nose in a minute. You can use any size tube. Size 7 endotracheal tube will probably allow you most of the NG tube sizes through them. So you can use any size NG tube through them. So need to jelly the tube really well for inserting through the nose as well as bringing it out through the mouth. So it need to be jellied nicely. So put liberal amount of water-based gel, insert it through the nose and bring it out through the mouth. In most cases, the NG tube, when you're pushing it, if it goes fine. If it doesn't, it coils in the mouth. So you can just put your finger in and take it out from the mouth. The next thing we need to do is to take our split endotracheal tube and jelly that as well and insert it into the esophagus. It will go in straight into the esophagus. So you just insert it into the esophagus. And through this, you thread your NG tube in. Thread it all the way. Take a good length of it so that you have decent amount of length in the esophagus. So let's say I'm drawing it up with okay, and then pushing it up all the way. And then the slit will actually come out. So it'll come out through the slit. So you just bring it out. And keep hold of the end, one end, or you can keep pushing it and pull out the other end so that it's nicely in place. So that's all done. So that's how we use the split endotracheal tube for NG insertions. It makes the thing, it's 100% safe proof. It is success, 100% success with this technique. We don't have to struggle with it. And thank you for watching the video. I hope it's useful for all of you. And I have another trick which I'm going to publish soon. And so